where and when is palliative care delivered? Before we can answer these questions, we must look at where people die in Singapore. So, where do patients die? Almost 2/3 of deaths occur in hospitals, while about 1/4 occurs at home and the rest in nursing homes, hospices and other venues. Of all deaths, 10% will die suddenly, which means 90% will need end-of-life care. With the majority of deaths occurring in hospitals, let's look at what kind of deaths do hospitalized patients have in Singapore. In a study in 2005, the findings are disturbing. The authors found that patients often have troublesome symptoms, and resuscitation is not consistently discussed. Even when death was expected, patients could be subjected to CPR. Hence, palliative care delivery needs to be at both hospital and the community settings. Please refer to the VAP on types of palliative care services to know more about these services. So, when and how is palliative care delivered? Palliative care is better delivered early in the trajectory of the life-limiting illness than late. In a landmark study by Tamel et al. In 2010, patients with stage 4 lung cancer randomized to early palliative care has better quality of life, less depression, and longer survival than those given standard care. Subsequent studies have also replicated similar findings. So patients with life-limiting illness on nasogastric tube feeding, or total parenteral nutrition, or IV antibiotics, or chemotherapy, or targeted therapy, and other life-prolonging measures can benefit from early palliative care alongside such measures. These treatment and palliative care are not mutually exclusive, but are complementary. So, how is palliative care delivered? Just like the saying, it takes a village to raise a child, it takes a village to deliver good palliative care. Palliative care is delivered via a multidisciplinary team approach, whereby doctors, nurses, social workers or counselors, allied health professionals, pastoral care workers, and lay volunteers all have a role to play in one way or another. Each has a different skill set to bring to the table to effect the holistic care that defines palliative care. Palliative care can be delivered at 2 levels, the generalist level and the specialist level. The former has the basic palliative care skills and knowledge, while the latter has more expertise to deal with complex cases. For example, the generalist can handle mild to moderate pain and straightforward depression and anxiety, while the specialist will manage the refractory or more complicated pain and symptoms. Equally, the generalist can hold discussions about prognosis, goals of care, and resuscitation status, whereas the specialist can address complex communication issues like conflict resolution, suffering, futility, demands for hastening death, etc. The healthcare providers for these 2 levels are also different, with the generalist being the majority of healthcare professionals in both the hospital and community, while the specialist is a smaller group based in hospices, home hospice care, and hospital palliative care teams. So, in summary, palliative care is delivered in all care settings and can be beneficial if delivered early in the trajectory of the life-limiting illness. In addition, palliative care is delivered through teamwork and at both generalist and specialist levels.